Sharper Point Commentary, presented by Schwartz Laser Eye Center.
It is National Overdose Awareness Week. Not something to be celebrated, but certainly something to signify. While overdose deaths were down slightly last year compared to the year before, they were still way up from just 4 years ago when the government, in many areas, insisted that Americans not gather in groups in an attempt to fight the spread of the disease COVID. But gathering in groups is essential to people like me to fight our disease of addiction. So it makes total sense that people, lost without the help of other addicts and alcoholics, would be ODing at a higher rate. I know lots of people who relapsed during and after the pandemic, and people who died of overdoses. I never overdosed, although based on some of my drinking escapades and hangovers, a case could be made that I OD'd on alcohol, which can kill you just as dead as a drug OD. And when I was living in my addiction, I mixed prescription pills with booze, which is playing with fire. So I don't know if it was grace from the big guy in the sky or just dumb luck that I never experienced an overdose. My dumb behavior only ended when 13 and a half years ago, I stumbled into my first recovery meeting and was approached by a guy who asked me if I had a sponsor. Having no idea what that is, I wondered to myself if that meant he was going to do commercials on my radio show or if I had to put on his logo on a NASCAR jumpsuit or something. Luckily, it didn't. It just required me to follow him through the 12 steps. No rehab needed. This morning, we've been playing reports from ABC's Daria Albinger about an event at the White House today marking National Overdose Awareness Week.
President Biden has witnessed addiction with his son Hunter's much-publicized crack cocaine use in rehab.
And I was glad to hear that certain people will be attending.
Today, administration officials will host advocates and families who have lost a loved one to an overdose.
Because those people can relay vital information to public health officials regarding fighting addiction, even though they aren't addicts themselves. But other people, while they may have great knowledge, don't really have much to offer addicts.
HHS Secretary Javier Becerra and Dr. Raul Gupta, White House Office of National Drug Policy Director, among those attending. President says
because what addicts and alcoholics need is the help of people who understand the addict brain and addict behavior, other addicts. And it's only us that has this special superpower of being drunks or addicts or whatever particular substance you happen to be addicted to that can help another addict or another alcoholic in the way that it takes to keep our addiction at bay. And it's something we have to stay at for the rest of our lives. It's not tough once you reach that point if you put your trust in things like the program and your higher power and these other sorts of things. But it has to start talking with somebody else who shares your problem. By the way, once again, no rehab needed.
Thanks for watching Sharper Point. Click to see more from Arizona's Morning News and tap the button in the middle to subscribe.